Now, there are certain issues that can certainly make your life slow down. Take an ankle injury, right? The pain can make every step difficult. And in this sponsored segment, we're going to focus on ankle arthritis specifically today with Dr. Terrence Philbin of Orthopedic Foot and Ankle Center. Good to see you, doctor.
Great to see you as well.
All right, before we get into the issue, I like to get some background because people hear about, ortho foot and ankle. They want to know what makes you special, what makes you unique.
Well, our singular focus is the foot and ankle. Anything from ingrown toenails to wound care to bunions, reconstruction, fracture care, sports injuries, and even total ankle replacements. We do all of that. So that our main focus is just foot and ankle.
And this was kind of a personal thing for you because you were a football player. And what did you see? What did you suffer with that you thought, like, yeah, I want to do this as a specialty?
Well, I actually had a knee injury, not a foot and ankle injury, but when I was in college, I injured my knee, and going through that whole experience was fascinating to me. I didn't really want to do business like my family did, and I actually thought at that point there was probably a better way for it to be done in the future, and it's because of that unfortunate injury that really propelled me to want to go in and be an orthopedic surgeon.
So today's focus, Dr. Philbin, is ankle arthritis. First of all, explain to us what that is, what's going wrong when that's happening.
Right, so arthritis can happen in any joint in the body. All of our joints are connected by ligaments in a capsule, and we have cartilage that just covers the end of the bone. It's a smooth, durable surface that protects the ends of the bone. And from wear and tear, from injury, we lose that cartilage. We develop spurs, we get inflammation, we lose motion, and we have pain. And that's the thing that ultimately bothers people when they have arthritis.
And the thing about it, you mentioned wear and tear, right? Injury, age. These aren't things people can really prevent, right?
In most cases, they can't. I mean, certainly, having certain injuries, being overweight, those kind of things can kind of propel things further. But in many cases, they can't prevent it if it's just wear and tear.
So if they do end up being diagnosed with this, let's talk treatments. Is this something that requires surgery often? Are there other things prior to that?
Well, it really depends on the severity and how much it's impacting someone. I mean, certainly when you're limping, that and you have that kind of a thing, it can affect all the way up the chain into your knee, your hip, and your back. But there's a lot of treatments that can be helpful non-operatively, such as steroid injection, bracing, different kind of creams, things of that nature. And if those things ultimately don't work or are not really a good option, then that's when surgery becomes an option.
And the surgery we're talking about too, total ankle replacement, right? So we're going to talk about a patient too. I believe her name was Amy that you had. What was her injury? And then, tell us about this surgery and what it entails.
Well, when it comes to surgery for ankle arthritis, there's different things that you can do. Sometimes if it's not terribly severe, you can just do a clean out arthroscopically. Some people are good candidates for an ankle fusion, which is still a very good surgery in many cases. And then people that, the other option is going to be ankle replacement. So that particular patient, she had a trauma, a bad injury at the end of her ankle bone and her ankle joint, and over time developed really bad post-traumatic ankle arthritis. And she had some other treatments and ultimately had an ankle replacement and did very well.
And did very well. And so what exactly, when you're talking about a replacement too, is that something where you can't walk for a while? I mean, what's the recovery like after that? Because it seems like a pretty, significant surgery.
Right. It's depending on your age and things of that nature. Sometimes we can do it outpatient nowadays.
Wow, okay.
Some older patients that may have other comorbidities may need to be in the hospital, but generally speaking, most of our patients are non-weight bearing for about a month.
Okay.
So first week they're in a splint, and then they're cast for about 3 weeks. And if everything looks good at that point, we want to get motion going as quickly as we can with therapy. So in many cases, they're weight bearing as early as 1 month after surgery, at least in a boot to start.
In a boot to start. In fact, you had sent us some video of another of your patients after they had this surgery. And what is their reaction? Because once they probably walk without pain, right, I imagine it's pretty significant, right?
Well, in the patient in the video, it's amazing because you can't really tell exactly for sure. I mean, I can obviously, which ankle we did the replacement. I mean, no one's going to get a normal gait, but it certainly improves their gait. And some of my most happy patients are patients that have had ankle replacements, but it's not for everybody. It has to be the right person, and they have to understand, everything we're trying to achieve.
And what was his reaction? Was he just like ready to skip out the hallway or what?
He's very thankful. I mean, he's literally a gentleman who says that this changed my life.
Yeah. And is that the expected outcome for a lot of those patients that get to that point, doctor? And I know things obviously matter depending on a lot of factors, but
I mean, the expected outcome is to get rid of your pain, to try to maximize your motion, not going to be normal motion by any means, and to try to have a normalized gait, not a normal gait, but something where you're not limping in as much, and so it's not affecting, again, all the way up the chain.
yeah, and your daily living. I feel like that affects a lot of people. They get embarrassed maybe to go out and do that, so this could be a life changer for a lot of people.
In many cases, yes.
All right, Dr. Philbin, I want to send people orthofootandankle.com. They have multiple locations, so you can connect to one of those. Which location are you at, Dr. Philbin?
Well, we have locations, just really quick, in Zanesville and Grove City and in Dublin, as well as the Worthington location. And I'm in Dublin and Worthington mostly.
Okay.
Yeah.
All right, perfect. So you can certainly find one near you if you're in Central Ohio. Thank you, doctor.
Thank you.